Now, it appears that there is more than meets the eye in the now controversial health equipment supply project. Now, a group of biomedical engineers say President Uhuru Kenyatta's leasing scheme is cost-effective.
But the governors, however, maintain that they will not sign the 38 billion shilling deal. Asha Mwilu reports.
All 94 hospitals.
From snubbing the president's big launch,
we think the governors are fully on board,
to arguing that the counties were not fully consulted.
Consultation and establishment on several issues, including personnel. There were several discussions to be done.
Governors have been a tough crowd for the president's 38 billion shilling project to lease medical equipment to the counties. And now the pressure is just piling up.
Madarasa ya medical equipment tunaletewa to the last page na kuambia sasa weka kidole hapa. Tunawauliza and the other contract page 1 mpaka page 600 inasema nini? Wanasema hiyo umesomewa na Macharia. Ati Macharia amesoma hiyo ni sawa. Kwa hiyo weka tu kidole hapa.
The county bosses have done their math. They argue that if Meru County, for instance, was to buy the same equipment offered by the national government, it would cost the county 181.6 million shillings to fully equip 2 hospitals. Under the president's leasing scheme, however, taxpayers would cough up 223 million shillings to lease the equipment for 7 years.
95 times 8 is 760 million. For equipment worth 180 million. Nani anachukua ingine? Hii ni uporaji.
But while the governors argue against the leasing scheme, biomedical engineers say the president's decision makes sense.
Equipment have a lifespan of 1 to 7 years, but it can go beyond 7 years depending on how you use it.
One of the best things that leasing of an equipment saves taxpayers money is about when you have to decommission. Once they are on leasing, you can ask the owner of the equipment to take it away.
This question on whether to lease or to buy the equipment has driven politicians further to their extreme ends of the divide. Counter-accusations of the intentions behind the project are now taking center stage.
I think we made a grave mistake in fully devolving the health functions to our counties.
And because some members of parliament partake of those deals, they are unhappy that governors will be in charge of procurement.
But as the politics heats up, the Kenyans affected by these decisions are struggling to get their leaders' attention. Cancer patient Henry Osieko, living in Eldoret, is still planning his trip to Nairobi in search of radiotherapy treatment.
Sasa nikakaa juzi wakaniambia natakiwa uende Kenyatta ufanyiwe radiotherapy. Baada ya radiotherapy ukae 1 year. Alafu hiyo 1 year utakuja ufanyiwe graft.
And as Henry saves up for his treatment, once he gets to the Kenyatta National Hospital, he has to join the long queue of patients struggling to get to the one machine that exists here.
Wakawa wametuambia next booking itakuwa ni 2016 December ndio anaweza kupata slot ya yeye kufanyiwa radiotherapy.
Should the specialized equipment be bought or leased to the counties? Is this a responsibility of the national or county government? Is the devolved healthcare working for Kenyans? These are all questions that the political elite are asking. But the only question that these cancer patients want an answer to is, will the medical equipment get to them before it's too late? Asha Mwilu, KTN.